I was born in Victoria, Texas. I'm one of 6 siblings. I mean, we have 5 brothers and sisters. And my dad worked on all the jobs nobody else wanted to do, and I was his right hand, left hand interpreter. I did everything for him. I learned a lot about hard work, but more importantly, I learned about being nice to people, the culture and the rich culture that we belong to, and also the importance of customer service. I lived in Victoria all my life until I went to the Army, and I spent 3 years there during the Vietnam era. Fortunately, I didn't have to go to Vietnam. I was in Anchorage, Alaska, learning about healthcare, actually. I worked in a hospital. I came back, I knew what I wanted to do, and I went to work at it. I got my hospital administration degree, and my first hospital was in a small 44-bed hospital. I then progressed there from there I went to larger facilities, being an assistant administrator, chief operating officer. I was the vice president executive for Kaiser Permanente for 5 years. A CEO for Los Angeles County USC Medical Center. I think I've been fortunate, and I've got some good experience to bring to this organization. I like the focus of addressing the community needs. I mean, this is the very intensive acute care facilities with high tech, and they can do a lot of good things in the community or for the people. Everything that we get at the hospital starts at the community, and so the key is to really understand what are the disease, what are the prevalence rates, what are the issues that the community needs from the hospital, and the hospital to really be one of the best in the country to try to address those needs for those community members. It's a very intense, and we have to do a good job in becoming one of the best in being safe and reliable and culturally sensitive to the patients that we serve. To be a low-cost, high-quality organization in any place is hard to do, and you're already there. My hopes is that I can build on that, not only stay at the top level in the quality arena, but be the people's choice. When they think about healthcare, I want them to think about Salinas Valley. I want them to think that this is the place to go if you want to take your family and your friends to. Well, I think that would be the nice gift that you bring to the community, to be able to provide a higher level of care for the folks here. There is research, and research always supports level 1, level 2 trauma. It helps. It helps the survival rates of those patients that are in a trauma situation by about 25–30%. Research supports it. So the families do not have to travel far, or because of every minute counts in many of these situations. So if we can step up, if this community can depend on us to provide that level of care, it'd be a great gift for the community.